So the last year for you, what's been the highlights?
I think for me, the highlight in the last 12 months at the centre has been that we have been able to fill a massive gap in the Coffs Harbour community where people weren't accessing mental health services before. Having a centre in our community that you don't require a referral, a mental health treatment plan, a Medicare card, a healthcare card, you don't need anything to access. It's free, you just need to be 18 years old.
Yeah.
So for me, I think that has definitely been the major achievement of the last 12 months, providing mental health care to our community that otherwise they wouldn't have been able to access.
And really good quality mental health care.
It's great care.
The sort of care that you wouldn't have been able to get if you weren't engaged with private services in the past and you didn't have the money to get along to those services. So I think that's probably been a big highlight. I think the other highlight's also the team.
Yeah, definitely.
It's been a crazy 12 months to bring a team on and get them up and running, managing quite a complex amount of presentations as well.
Yeah.
You know, we've seen high rates of AOD in our presentations. We've seen a lot of mental health complexity in our presentations. We've seen homelessness, a lot of people struggling financially as well. So there's so many different aspects that the clinicians and the clinical team are trying to deal with.
Yeah.
And, you know, just them getting up and getting going really quickly, and the feedback's been amazing. So the stats we have in the first year is more than 80% of the people that are engaging in treatment with our services are noticing significant improvements in the time that they're with us, which is incredible.
And it's quite a short period of time, you know, being up to 6 months. So for those things to be happening in such a short period of time, you know, is a real testament to the work that the clinicians at the centre are, you know, the work that they're doing.
Yeah, and it's a great crew.
So what do you think's next?
Fun. What's next? So I think we have a really good view now on the sort of presentations in Coffs Harbour. I mentioned some of them before with the AOD usage, some of the complexities that we're seeing with a lot of trauma, some bipolar presentations, complex and acute mental health presentations. Some of the training and the development that we've been doing with the team is in helping them to improve their clinical capacity and what they can work with. And so we've done quite a bit of work in upskilling the team in trauma work, which is really vital. We see a lot of trauma coming through the door from, you know, it could be childhood trauma, it could be neglect. We see natural disasters, trauma that comes from different situational crisis as well. So a lot of the focus is on doing that sort of work, but also ensuring that it's done in a way that they're supported, we're meeting with them where they're at, we're not pushing them through as well.
Yeah.
Have you got anything else to add on what's coming?
I just think for the next 12 months, our focus, and particularly from a partnerships perspective, it's just continuing to build really strong relationships with local services so that we can ensure that the people that are presenting at the centre are getting the appropriate supports. So if the centre isn't the most appropriate support, it's really important to us to have strong relationships with other services so that we're able to guide that person into the right support.
Absolutely.
Yeah.